Okay. Okay. So hello everyone, welcome to today's community call. So in today's community call, we would like to do a quick review of the APAC Symposium that happened 2 weeks ago. And then we'll start kind of the main topic for today, which is to have further discussions on the two studies that were selected or during the pool in a symposium last 2 weeks ago as well, which are the characterization of non-communicable disease by Professor Seng Chan You, and then we'll have another study discussion on the comparison of mortality, healthcare resource utilization between the patients with or without COVID by Professor Trey and Dr. Lee from Hong Kong University. And just a quick preview too, in our next community call 2 weeks later on December the 16th, we'll be discussing the other two studies that were selected during the symposium. So please join us in 2 weeks as well. So with that, I will do a quick review of the APAC Symposium. Thank you so much for joining us. So we had, I think, 85 attendees in the morning sessions. That I think was definitely great to have all of you guys here. And also we have the global leaders to give us all the statement of the community and a recap of what 2021 is like, and then what's will happen in the 2022. So thank you so much for joining us. And then in the afternoon, I think that was really the part I enjoyed that we had in Town. There was a lot of great discussions. I think there were 3 hours of different discussions that may or may not run over time, but I think hope everyone had a great time in Town as well. So for the morning sessions, if you miss any of that, or if you want to rewatch some of the videos, so everything is now up in the OHDSI APAC page that I have the link here. So you can go in, and all of the morning recording sessions that are here, you can access through YouTube videos. So with that, I will go to our first study discussion from Professor Seng Chan You on the characterization of non-communicable disease. So for that, I will start playing the recording. All right. Please let me know if you can hear me.
Hello, this is Chan. I'm going to talk about the characterization of non-communicable diseases across the pandemic, which was chosen as next OHDSI APAC study in 2022. As we all know that COVID-19 has a huge impact on everything in the world, and one thing would be the incidence of the disease. And the previous study, which was published in Lancet, is the Health, shows that there are many diseases. The incidence of many diseases actually decreased after COVID-19, and we don't know. But still, in this study, they focused on the several diseases, including diabetic emergency, anxiety, depression, eating disorder, myocardial infarction, heart failure, unstable angina, and COPD excess or asthma exacerbation. In the previous OHDSI work, the characterization, health associated risk, and your baseline disease in SARS-CoV-2, we aim two objectives. First, we try to describe the baseline demographics, clinical characterization, treatment symptoms, and outcomes of interest among individuals with COVID-19 overall and stratified by sex, age, and specific comorbidities. Second, we aim to describe characteristics and outcomes of influenza patients between September 2017 and April 2018 compared to the COVID-19 population. This was the huge collaborative research project of OHDSI. And as you can see, that there are many products from this collaborative research published in medRxiv or peer-reviewed journals. We try to investigate the association between obesity, drug utilization, autoimmune diseases, pregnancy, pediatrics, HIV testing and intervention, and SARS-CoV-2 infection. So in this study, I aim to identify the incidence, prevalence, and treatment pattern of non-communicable diseases across the pre- and post-COVID-19 era. And furthermore, I'd like to identify the temporal causality between COVID-19 and epidemiological changes of target diseases. So I'd like to answer to the question, does COVID-19 change the incidence, prevalence, and treatment pattern of non-communicable diseases? And if so, would it have an impact on future burden of non-communicable diseases in the world? This is the tentative process of the study that I thought. We need to define the target diseases first. So I don't focus on the hypertension or cardiovascular diseases, but I want to make this as a very big, large-scale OHDSI APAC collaborative research. So I want you to define your. I want you to have your own target diseases, and please join the study as co-workers. So you can study any non-communicable disease, or you can study communicable diseases if the overall study design fits in this study. So please let me know that if you have any target diseases of interest. And we need to define the codes for target diseases such as hypertension, diabetes, or others. So should we define the hypertension as just by using hypertension diagnosis only, or should we use the blood pressure levels and the EHR, or should we use anti-hypertensive treatment to define the target diseases? So it's up to us. So we need to define the course, and we need to conduct a course diagnostics to verify our course phenotyping is correct. And I want to add stratification such as gender, ages, group, or races, or something. So we need to define the stratification criteria. Then we will develop the package for wrapping all of this, and then we should conduct the package through across the OHDSI APAC network or global OHDSI network. Then we will collect the results and then do some temporal analysis. We need to discuss about this further, which temporal analysis we need to use or we should use to identify the temporal causality between COVID-19 and the changes of diseases. So what should we do? I just let you discuss about this further in this meeting. Thanks.
All right, so that's for the quick introduction from Professor Seng Chan You on the study stuff. So I'll give that to you, Ken.
Okay, so thank you, Jing, for playing these recordings. Usually, I'm interested in the common chronic diseases of which incidence or prevalence will not be dependent on COVID-19. I do not think that hypertension, the prevalence or incidence of hypertension, essentially are dependent on COVID-19. Whether COVID-19 has an impact on future hypertension prevalence because of the poor weight control or poor exercise during this pandemic season, but the real incidence will not be changed during this season. But if the incidence of these kind of diseases are changed in our data, then it means that there are more hidden hypertensive patients. So it may be we need to surveil. We need more active surveillance for this chronic diseases. That's why I'd like to investigate the incidence or the prevalence of these diseases. But again, I want this study to be a collaborative research through APAC network, such as Characterization in the previous year in OHDSI. So if you have any comment or if you have any interest on this, please let me know, and please write down your your disease of interest here.
So I do have a quick question, Chan, because I think non-communicable disease is really broad. Like you said, for the to do for next step is to identify the disease. I'm just thinking because it's a really wide range of things that could be, are most of disease, I guess, is non-communicable. And you listed like hypertension or diabetes are more like chronic disease parts. So is that going to be the focus here, or will there be more other like disease area, like let's just say like dentistry or like orthopedics or pediatric thing, or like it could be a very wide range. So because I see you have those two there. So will that be the focus, or it's not limited to chronic disease?
Yeah. So again, this is the cardiovascular disease is the disease of my interest, and so
Okay.
yeah, we can add pediatric or orthopedic diseases on this.
So that's, will you be adding that, or that's kind of can be the plan?
Yeah, it can be the plan. So please let me know that if you have an interest on certain diseases or certain areas, then we can add it. But still, you need to provide the core definition or phenotypes for that disease. That's how we will conduct collaborative research. So that if you are interested in certain diseases, then someone should provide the core definition or phenotypes for that, and that should be validated through core diagnostics or other processes in OHDSI.
Got it. It was just the reason I asked the question is really, I think there were I live in China, obviously. So there were some discussion actually last year because of, for other, because of COVID, we were kind of overlooking other disease. Like orthopedics was one of them, because people were there like in between of whether they or not to have surgery, but because hospitals are so tight and policy everything, they're like postponing their surgeries, and was kind of greatly impacted by COVID. So that's why kind of I was thinking those areas could be, I know they are not oftenly studied in OHDSI studies before. So I was just curious if that would be something interesting to look at.
Yeah.
Like more operation oriented disease, I
As
guess.
as Patrick said in the chat that I'd like to focus on the incidence of something like disease or surgery like that. But and but I want to see the prevalence because I want to calculate or estimate the burden of the incidence on the prevalence. Like in hypertension, for example, hypertension, the annual incidence of hypertension is about less than 10 percentile of prevalence. So if the the changes in incidence, we should estimate how the changes in the incidence affects on the prevalence of the disease. That's why I wanna just see the prevalence, but usually we're going to focus on the incidence of disease or some procedure, something. Again, if you can provide or we can define the right definition for that.
Got it. Cool. I was just thinking, kind of using the Atlas data sources trend to see, for each disease, just looking at that would be a quick thing that we can check whether the disease incidence have a drop or increase after the pandemic. Cool. So do we have any other questions from the audience?
You can ask me through mails, or you can add something on the thread of this NS Teams. Just feel free to reach me or add something on this.
All right. I think that's thank you so much, Chen. And if and we'll have you can contact Chen directly for any questions or participation. So thank you. With that, we'll go to the study discussion. So Chen, anything you want to add? Okay, thank you.
No,
Just
no.
want to make sure. Okay, so with that, we'll go to study discussion number 2 that were selected during the symposium, which is on a comparison of mortality, morbidities, and healthcare resource utilization between patients with or without COVID. So with that, I will turn to Professor Choi. Celine?
Hi everyone. So actually we have Dr. Eric Wan here. He's one of the PIs of this project and he'll be presenting on our behalf. So
Okay.
Eric, please.
Okay, thank you very much. My name is Eric Wan. It's also from the University of Hong Kong. And this study, we will study the direct impact of COVID on the to study the COVID direct impact of COVID. So that is indicate we will evaluate the COVID complications. So we have three objectives. So this three objectives quite simple. We just want to see the short-term, medium-term, and long-term mortality, health utilization, and adverse event of the subgroup analysis on child, elderly, and patient with multi-morbidity. So can I control it? Actually, I can't control the slide.
No, would you like to share your screen?
Oh yeah, sure.
Okay.
So can you see my PowerPoint?
Yes,
Okay,
I can.
yeah.
Thank you.
Yeah, as mentioned by the Professor Singh, apart from the indirect impact on the non-communicable disease, we would like to investigate the direct impact of COVID-19. So we would like to evaluate the trial outcome, including the mortality between people with and without COVID infection. So, and this is just a background. I think you guys already know the impact of COVID and their adverse events. Some study also based on some adverse event after COVID infection. And these are the objective which I mentioned before. And this is our study design and methodology. And we would like to have a cohort study using multinational healthcare data, and we have multi-table source, and we are welcome you join this study. And our population is quite obvious, so is patient with COVID-19 and the people without COVID-19 during the inclusion period, and then we will follow them 6 months to 1 month, and then 1 to 3 years to see their short, medium, and long-term outcomes. And this is our data source, which we are able to access now. So we have our Hong Kong data from the Hospital Authority. This electronic health records from the 2006. We have around 7 million people available in this data source, and we also seek help from the IQVIA. So we have other data source from other countries, and then. As I mentioned before, for the study population is quite straightforward. So we have two cohorts. One cohort is COVID-19 cohort, and another one is non-COVID-19 cohort. And for the first COVID-19 cohort, so we define the people have a record of first positive or for COVID-19 during inclusion period. So the inclusion period is from the 2019 December 1st to 2026 June 30. Sorry. So, and the index day is quite obvious. So it's the day of positive test during the inclusion period. And for the non-COVID-19 cohort, so people will be without any cohort record of COVID-19 test or positive test during the inclusion period. And there in that state, we will set all the people in this group will be at 1st December 2019. And for the follow-up period, it's quite straightforward. So instead of we will follow up until the outcome event, mortality, censoring for last to follow up, and then end of study period. And for the non-COVID cohort, people will also censoring if they got the COVID infection. So and then we just have these two cohort, and for the statistical analysis, we plan to maybe use the p-test matching and then do the cost regression, and then we can get the short-term outcome, medium-term, and long-term outcomes. And these the outcomes which we would like to investigate. So the first one is straightforward, all-cause mortality, and then we would like to see a series of mortality, and including the cardiovascular disease, respiratory disease, something like that. And also, we would like to see the impact on the health civilization, which including the outpatient, consultant, emergency admission, hospitalization, something like that. So we understand that some database may be not available on some outcome, especially for the health civilization. However, we are welcome if you still have some outcome which is available. For example, the mortality or anything, morbidity, we are also welcome. So you do not need to have a full every single outcome in order to join. So if you have partial outcome and also interest, we are also welcome. So we hope to hear from you and work with you on your data set. And then actually we have several key members in this study. So we are all under Professor Ian Wong, and we have another collaborator, something Celine Choi and Shelly and Carlos Wong. So if you want to join, just feel free to contact us. So yes, that's it. So if you have any comment, we are very, very welcome for your comment. So our question, something like that. So thank you. So have any questions?
Thank you, Eric. So I see we have a comment from Patrick that the study, we could also, it would be great to catch up with Eric was. Sorry, I don't know the right pronunciation for the last name, which I think there's another adverse events study about COVID infected population that we could reference to.
Yeah, sure. Yeah.
I think that study is probably already on GitHub, Odyssey GitHub study as well.
So you mean there is another study studying the
similar, not the same, similar. I think it's about utilization with or without COVID.
Oh, really? So we may we are not aware of this one. So maybe we check it, then see what happens. Yeah, maybe we can join together and then to study it in terms of the health civilization part.
Yes. So Patrick, I don't know if you could elaborate on the comments you have.
Yeah. So it is not the same study as what you want to do, but I think there would be several components of it that would be very helpful reference. So what Erica is leading is a study that is trying to characterize the incidence of adverse events following COVID infection. And the specific purpose of that study is because we have previously published work to show the background rate of adverse events in a general population. And this work will be to characterize the adverse events following COVID infection. And hopefully that provides some context for those who are worried about the adverse event rates following vaccination, to understand that even if the vaccines do cause adverse events, they likely cause them at a rate that is much lower than the natural rate of adverse events that are attributable to COVID itself. The reason I was pointing that out here is because first, the community has done a lot of work to create a standard phenotype for COVID infection, and that would seem to be directly usable here in this study, but also as a study package and as a model and a template for an analysis code that could be run, be able to borrow some of the work that's been done in Erica's study. I do think you are looking to do different outcomes, at least in your characterization. You did mention that you want to do propensity score matching to compare the COVID infected population with the uninfected population, and I'm not. It was not clear to me what it is you're doing there. That would certainly be an element that would be different, that we would need to flesh out a little bit. But at least as it relates to starting with the basic idea of trying to perform a characterization where you quantify the event rate of a particular outcome in a COVID population as well as in a non-COVID population, I think Erica's study could provide a good, useful starting point for some code for you.
Yeah, thanks for your helpful comment. So as we in this study we want to compare head-to-head comparisons instead of compare the background incidence. So I think so that we consider to use the propensity score mapping to see the difference between difference in terms of COVID complication between people with or without COVID. But I mean, your comment is quite helpful, so we will look at their standard COVID complication phenotype and then see and the package and then see how can we define the outcome clearly. Yeah, thank you very much. So, have any other comments and questions? We are welcome. And we can't see the chat box actually. Have any comment from the chat box? So sorry, I'm first used the Microsoft. Yeah.
Oh, I think that's feel free to sign up. I'll post a link in the I'll send you a link directly because there is I'll send the comments to you to your email because you have to sign up for OHDSI Teams in order to see the comments. I think that's why you're not seeing the notes, or I didn't realize that earlier. But I will copy the comments from Patrick and the link to the study Erica that Patrick was referring to through an email to you.
Yeah, thank you very much.
Cool. I do have a question for kind of the comparator with the non-COVID patients, because that could be, anyone. So anything kind of, the comparator cohort, like, do we have any specific, just thinking about that's a really big group of people. And then if you're doing PSM matching or anything you want to restrict for the comparator cohort?
Yeah, actually, we also think this quite tricky to pick up the long COVID cohort, and we just want to make it straightforward. So we design to just people without any COVID record of COVID test or positive, then this patient will be included in the cohort, and then we will use as you mentioned, we may use the PS matching or PS rating, something like that, and in order to maximize the data used in the study. But of course, if you have any other suggestion, we are all welcome. As initially, we think we try to maybe one-to-one matching to the COVID patient. However, I don't know whether is it feasible in the OHDSI programming, as you know, if we do the one-to-one matching, then if we have let's say our patient want their index day maybe 1st January, then we need to match another one and then set their index day 1st January. And for another one, patient B, if they have COVID vaccine, COVID infection on 2nd January, then we need to generate again from the pool to find the control, and then that control will need to also set January 2nd. So I don't know which approach is feasible or not. Maybe have any suggestion to select the control group. Maybe I don't know. Yeah. So maybe we are welcome all the comment and suggestion. Yeah.
Yeah, I think part of the reason I want to ask is that I think we were, so Patrick, sorry, I'm gonna, I think we went in the trainings that you did before on PLE. I think we were, like, I think in a training that I think was saying like for target cohort, let's say drug A or drug B, like we should be comparing to a drug B instead of, you know, if like the whole population. So I was just wondering like if you have any suggestions here.
Yeah, I think one of the challenges that we're going to face here is in defining a non-diseased population. We need to be able to define an index date for when is that moment that we are going to be asserting that they don't have the disease.
Exactly.
And we'll have to follow them up for some period of time. It's our tools can handle, like all of the OHDSI tools can handle this perfectly fine. What we would probably want to do in this context is if you want to try to create this non-diseased population, we would probably be defining an anchor event, which would either be a calendar date or it would be something like just a visit to the doctor. And then we would follow them with a right censoring of if they observed COVID, then we would truncate them at the time of their COVID. So that's perfectly reasonable to define in Atlas. I would encourage the team to take a look at Anna Ostropolit's work that she that we presented at the OHDSI 2021 Symposium and was also highlighted on Tuesday's community call, which is the idea of the effect of anchoring. Because what she showed was that when you define a general population, that choice of whether or not your index date is, say, a random calendar date like January 1st, or it's the date of a visit, that choice actually matters and will impact your rate of your outcome rate. And so it's going to be an important choice to make. And you can't fully just correct for it vis-a-vis like propensity score matching, because in your case, your target cohort will be those that are COVID infected. That means by definition, they will have some health service utilization on day 0 because they'll have to be to the doctor to get their COVID positive test. And so therefore, there's going to be a reason why your two groups are fundamentally different. And I think that that's going to present a particular challenge in this case.
Got it. So I'm sorry.
Yeah, sorry. Thank you for your very helpful comment on that. And we also think that this may be properly set the index day as their first versus the daughter days or king data day. So this may be make the follow-up period more balanced between two groups, and also yeah. So we will consider it and then revise the cohort and then see which one is more appropriate. As why we set this one, as we think the inclusion period is very short. So actually the index day, if we set the earlier one, actually will not make a quite difference in terms of the follow-up period between these two groups. However, it's very good suggestion, so we will consider and then revise this and then see which approach may be better. Yeah, thank you very much, Patrick.
Yeah, so just to use that date as an example and just to think through the consequences of what Anna's work on anchoring shows. So imagine you were to select 1st of December 2018, a full year before the pandemic. Healthcare utilization in Hong Kong probably looked a certain way. But if I now take the 7 months after the 1st of December 2019, now that's basically during the entire interval when you guys were in tight lockdown and nobody was leaving their house or going anywhere. So health service utilization during that time was very different.
Yeah,
And
yeah.
so if you compare if everybody is set to December 1st and you have a fixed window of 7 months, but then you try to compare that to a COVID population where the COVID could happen basically like any time during the year 2020 or even into 2021, well, that secular trend of calendar time will matter quite a lot. And so that really was the work that Anna and George were showing, was that that impact of the choice of the index date for your general group can actually have quite a big bearing. And so, unfortunately, I don't have a solution to offer you, but it's something you will want to pay attention to, and to the maximum extent possible, consider trying to figure out how to match on calendar time to make sure that that particular part of the comparison is reasonable.
Yeah, yeah. We think it's also challenging to define the long-COVID cohort. So we will be considering how to define it appropriately. So thank you very much. Thank you.
Yeah, I think another, I think that would be very good point. Here really was for kind of the censoring event, kind of when the patient, when the comparator patients, they are no longer in a cohort if they have, if they have COVID. I think that's for sure. And then I think there might be others that we want to rule out, that they should not be continue to be in a comparator cohort. So I think that will be something we also could be adding to the comparator cohort.
Yeah, sure. We will censoring them if they got the COVID infection in the non-COVID cohort. Yeah.
Mm-hmm.
So yeah, this is very good. Yeah. Thank you.
All right. Any other questions from the audience or comments? Cool. So as you can see, I have sent a survey link, which is to kind of if you would like to join any of the 4 studies selected from the symposium, you can sign up there.
Yeah. Okay. Yeah. Okay. Thank you very much. Yeah.
All right. Thank you so much.
Thank you. So I stop sharing.
Oh yeah. Sure.
Yeah.
Cool. All right, thank you. I think that's all. That's all about the 2 studies that we're discussing today. And again, feel free to sign up for the studies, and then we'll share that information with the study owner. And then kind of we'll be working on that later this year and also 2022. Just a quick preview, in the next community call in 2 weeks, we'll be discussing the other 2 studies selected, which are about MS from Nicole, and then the other one is about data quality dashboard from Mr. Kim in Korea. So thank you all for joining us today. Thank you. Have a nice day.
You too.
Thank you.
Bye.
Bye. Thank you.
Thank you.
Bye.